1 o'clock on Wednesday, December 19th, and this is the regular meeting of the Measure B Committee. Welcome. We're glad you're here. We'll look to our clerk for a roll call.
Janine Miller, here. Jan McGordy. Present. Carmel Angelo. Here. Ace Barrett. Here. Ross Liberty. Here. Lloyd Weir. Here. Mark Myrtle. Jed Diamond. Here. Shannon Riley. Here. Thomas Allman. Here. Donna Muscati. Present.
We think Mark's going to be here, so we'll just note in the minutes when he shows up. Communication. We had some communication from
County Council.
County Council regarding, for the most part, let's see, you have a copy of that? I'm sorry, it's on my table. County Council has sent a note that, for the most part, if we need a County Council opinion, then we should put it in writing to the Board of Supervisors and allow the Board of Supervisors to give the direction to County Council, and Mr. Myrtle is here for the record, please. She is correct. County Council is correct on this. If we as a committee are not in a line to ask County Council for a legal opinion, but we can certainly, if you have a question that we believe needs to go to County Council, then we will route it to the Board of Supervisors, and if the Board of Supervisors feels that if they need a written opinion, then they will do that.
Sure.
Yes, Carmel.
Hi, Sheriff Allman, I understand obviously the process with County Council. I wonder about the efficacy of Measure B, the Measure B committee actually having an attorney here at every meeting. I mean, I think there might be some value in having our own attorney for this committee, and I just throw that out there to you, actually.
Well, I certainly
really talked about it.
Certainly not going to disagree. We haven't talked about it, but maybe that suggestion could be made to the Board of Supervisors, and if they believe that's necessary, because they're the ones who will be paying for it, they can make that recommendation. Unless somebody has a better idea. I mean, there's going to be cost involved in an attorney. We can't spend money.
Well, you know, as it stands right now, I think we have at least 3 questions that we need 3 legal opinions.
Right.
And so, I don't know if that's something that when you do the update in January to the board, something that we could ask. And I know it's kind of, I don't want to throw a curveball here, we could let that go, but my personal opinion is this committee needs an attorney.
I agree with that wholeheartedly, but because we've received I guess we could say an opinion from County Council regarding opinions, then we will have to defer to whoever the boss of the County Council is, which is the supervisors.
Okay.
So,
all right.
I'm going to open this up to public opinion, public comment in just a minute. Yeah.
Can I answer a question about that? Would it be possible to utilize one of the county's existing legal staff and just have them charge their time that they spend at this meeting to Measure B, rather than hiring a separate counsel?
If I could answer that,
yeah, sure.
I don't want to talk about our chief counsel as if she's not here, but I think to make the recommendation to the board that the Measure B committee have an attorney, certainly either our chief counsel or someone that she has on staff could be here at our meetings and could be our attorney in charge, I guess. Which would be much cheaper than a contract with an outside attorney.
That's the most logical opinion. However, we can't even suggest that.
Sure.
We can suggest it, but we can't. How about demand it? How's that?
Okay.
Okay, we'll work on it though.
Okay. All right. Any public comment on this?
So, thank you. Catherine Elliott, County Council, Mendocino County. I just wanted, I didn't think I was going to be here today, and I didn't want to send the opinion out with sort of explanation. This is an advisory committee, and I am very willing to assist this committee. Originally, we talked about that a little. It wasn't necessarily set up that way, but I have done the same thing for the Mental Health Advisory Committee when they were sort of struggling with some of their roles and how to bring things forward. Certainly willing to do that with this committee. What I'm cautious about whenever I work with any group is this is an advisory committee to the board. So, you know, I don't want to be spinning sort of wheels in either direction. So if it would assist this group sort of by getting some guidelines, I'm willing to do that, but I don't want to be in the situation where I'm advising you all one direction and then going against my board. So that would be, you know, and that's something, therefore, if I had the blessing of the board to be here, that would put me in a better position, so.
Right, and maybe I just have a problem with the word blessing. I think it would be more direction.
Direction, of course, which gives me, in my opinion, the blessing.
Any other public comment on the communications? Is there any communication? We're about to go to public comment for any issues that are, or any items that are not on the agenda. So at this point, if you would like to discuss any item that's not on the agenda, please do so. At the podium, please state your name.
Hi, my name is Mika Feretta, and I just want to say last month when you guys had your meeting, I think it was KZYX was here and reported on it through the radio station, that was incredibly helpful for me because I talk about it a lot to people and they kind of look at me like, oh, really? Is that true? And then they were able to hear it again on the radio station, and that reinforced what I was saying. So I think, you know, as we get this information out, that's really great because by the time it goes to the board, we will have spent plenty of time on it, and I want people to know that we've been doing that. So I don't know if they're here today, but I did. That was really a great service to get the information out.
What's your last name?
Feretta.
Any other public comment for items that are not on the agenda? Okay, thank you very much. So moving on to item B, or item 5A, I'm sorry, report on Measure B. I'm sorry.
We didn't approve the agenda.
I'm sorry, we did not approve the minutes, and so November 28th minutes. Has anybody had a chance? Yes, Carmen?
Sure. In reading the draft, there was one change that I'd like to make on page 9. What I said halfway down the page, Dora, I said that we would need to do a cost-benefit analysis, and it was recorded as cost-value analysis. So thank you.
So it's supposed to be what now?
Cost-benefit analysis.
Okay, very careful reading, very good. Janine.
On page 4, there it says staffing cost of $40,000 for 2 additional teams per year. It's actually more than that. The $40,000 was in addition to the handout that we handed out, so we want to clarify that the original, we looked at the staffing cost at $349, and then we said we needed to add another $40,000 to that.
Okay. So that would be
$89,600.
Right. Okay. So noted. Any other corrections to minutes? Donna?
Just one. First page, last paragraph, I believe it's DARCA.
Oh, okay.
I'm sorry, I didn't catch
The very first word, a name of Darsa Nicholson.
Darsa.
Any other corrections to the minutes? We may like to make a motion.
I move that we accept the minutes as amended.
Motion accepted.
I
Is there
second
a
it.
second? Any discussion? All in favor say aye.
Aye.
Any opposed? Hearing none, so carried unanimously. Thank you very much. And thank you for reading the minutes.
Yes, thank you.
Doesn't always happen.
I
Gotta give it applause.
guilty as charged. All right. Item number 5A, report on Measure B tax funds expenditure report with discussion of possible action. Lloyd Weir.
Okay, Chair Coleman, you should have passed out, or you should have a copy of the monthly statement that I give you each meeting. This one is through today. There is only one change on this, and it's an additional month of tax proceeds that we received on November 29th. $141,205 was the monthly total. And as someone has also already noted to me that it is increasing, and that is a very welcome sign. I'm not privy to details on why that's advancing at such a pace, but we'll take it and plan to discuss this with our sales tax consultant next time we meet. Usually we meet quarterly here at the county, so we'll be sure and include this subject as something we can try to dive into, although I really do feel we're going to need a full 12 months to kind of see the seasonal fluctuation of the economy and how it affects our county. And we do have some new businesses, big businesses, so that is also attributed. So down at the bottom, you'll see that life to date, we've received just over $4 million in proceeds, and our expenditures have remained the same at $199,048. We have 1 quarter of interest, so our balance currently is sitting at $3,863,213.
Thank you very much, Lloyd.
You're welcome.
Any public discussion? Cam?
Yes, I have a question. Is there some way that we can track where the sales tax is coming from? Like how much of it is from the coast? I had somebody ask for that information.
Yeah, so there are some detailed reports that we can get through our consultants. I don't have that information available to the committee at this time, but that's a request we could probably make through the board to the county's contract person.
Interesting question.
Because it corresponds with money put at the coast as far as the facilities go.
Yeah. Any questions about the presentation? Any public comment?
Could we have clarification? Is that
I'm
okay?
sorry, if you want to stop, just state your name, please.
Sorry, Carol Hester, sorry. Did you say October and November you have the money written down, or just October?
So the state is 2 months behind.
Right.
Okay, so they have recently given us their September proceeds.
Okay.
But we didn't get it until November 29th.
Well, that's what you were saying.
Yeah.
Okay. So they stayed blank.
Yeah.
Okay, thank you.
You're welcome.
Thank you for that. Any more discussion on fund balance? Okay, moving on. Use of Old Howard Hospital, discussion, possible action. Let me explain to everybody why I asked to have this on the agenda. We have several issues that we're dealing with. We're dealing with the possibility of putting something on Orchard Avenue. We have the Adventist Corporation has contacted us regarding the possibility of utilizing current hospitals for immediate psychiatric help, relieve their emergency room, and certainly we have Old Howard Hospital. And until we start removing items from removing possibilities or focusing on some possibilities, we're going to continue to always have these other items. When we talk about one topic, we're going to say, well, how's it going to affect this other thing? So what I'm asking this committee is, this is our 11th month of meeting, and I'm asking us to really and truly focus on what your thoughts are. Everybody on this committee is here for a reason. And Old Howard Hospital certainly has been talked about for many, I'm going to say every meeting we've had here. And I doubt it would be a unanimous decision one way or the other to continue discussing it. However, we have to get to the point where we're making decisions. And we're going to the Board of Supervisors saying, push this forward. While we haven't had 1 year of collecting taxes yet, the taxes began in April of 2018, we are certainly have a year's worth of meetings. And other than the MOPS decision that was made last month, a lot of our meetings have been conducted for the purpose of getting research and discussion of where we're going. And here we are about to start a new year, and by and large, the psychiatric health facility question, which has been with us for over a decade, we haven't come close to answering yet. And it's something that we need to discuss. And while this committee's role is not to direct the county's Department of Mental Health how they should proceed, nor is it our direction to work with the Behavioral Health Board, because they have their own goals. Our responsibility is to the voters regarding how to spend money for brick and mortar and for any additional resources out there, such as MOPS. And we have not made any decision that's binding that would go to the Board of Supervisors regarding brick and mortar for anything that's going to relieve the constant pressure that our mental health system has on it. When I say mental health system, I'm not just talking about Redwood Quality or the Department of Mental Health. I'm talking about law enforcement as a whole, our emergency rooms, and the whole purpose of how we got to where Measure B is. And so what I'm asking this committee to do is let's make a decision. If people are willing, I'm the chair, I can't make a motion, but if somebody is willing to discuss Howard Hospital and get to a point where we can vote one way or the other, I think that we're going to at least make one step of progress, one way or the other. So, that's my 2 cents. We'll open up for public comment after the committee has talked. Yeah.
I appreciate the desire to move forward as quickly as possible, and I want to say this very carefully because I want action and results as much as anyone else in this room. But one thing that I'm uncomfortable with here is that this committee accepted the Kemper report as a document that had been done by a qualified consultant. We did not adopt the Kemper report as a strategic plan. We don't have a strategic plan, and I feel in the absence of that, what we're doing is we're just receiving presentations from operators and developers about projects, all of which I'm sure have merit and value in our community. But I think what we need to do before we start saying Howard Hospital, yes or no, Orchard Avenue, yes or no, is to prioritize these projects to evaluate the Kemper report in the context of a strategic plan so that we know that we're moving forward with this type of project first, and this is how we're allocating our funds. So I'm cautious about moving forward with these decisions before we've had the big picture decision.
Anybody else like to weigh in? Dr. Barrett.
I agree with what you said. I don't think that it's obvious as far as a lock facility which way we want to go. We've talked about several different possibilities. However, I think that the idea of crisis residential treatment and crisis stabilization, to me, is fairly obvious. I mean, I think that this is the standard of care. I think it was the first #1 priority of Lee Kemper that this be built, and I sat here and asked him specifically about that. I think that in terms of patient care, it prevents people from going to a higher level of crisis. I think it's much quicker to build. I think it's much cheaper to build. I think that it serves the purposes that we need, which is better patient care, unloading emergency departments and law enforcement. And I think that we have a project that will go more quickly than just about anything else we've considered, which is the Orchard project. It includes crisis access, crisis stabilization, and crisis residential, which we probably need all three. And so I, for one, would be in favor of recommending to the board that we move forward with that project for a number of other reasons. Being that it'll be the most rapid project, I think it would be done in a year and a half. It's already been improved by the board and by the state, and already work done with behavioral health board in the county. It does not, and again, I'm not expert in a lot of these matters, but I don't think it would require an RFP, being as that it's already been approved by Board of Supervisors and by the state. My understanding, and again, I'm not an expert at this, is that they, for the construction team, which I know that RCS has their own in-house employed construction team that I understand is they could utilize them. And again, I'm not expert about this, but that it would not have to be prevailing wage for all of it. I mean, maybe the subcontractors would have to, but I defer to somebody who knows more than I do. So that's my 2 cents. Is that I think that I would feel comfortable making this recommendation to the board to move forward on this, and I'd like to see that happen.
Okay, and I think that's going to be discussed later, but this is still the right time to talk about it, because like I said, we're talking about so many balls are in the air. I don't think that we can isolate one without talking about the other. Ross?
When in our last meeting, what we left was that there were some questions on whether or not in-house construction team would be subject to prevailing wage requirements, and then the other issue was whether or not we could expend taxpayer money, Measure B funds, or whether or not we could recommend to the board that they expend Measure B funds on projects that's not their property. And those are questions that we asked, that we were going to ask of county council, and unfortunately, county council, said they don't want to answer that without the blessing of the board. But we've had several board meetings since then. I mean, they could have asked. It seems like that could have come up to the board in the interim, that hey, can they answer these questions? Because now I think we're left with a couple of data points here that are important to these decisions, of which Dr. Bear speaks, that whether or not we can go forward. But I don't think we know if we can go forward with that in-house construction and all that stuff.
And to Dr. Bear's point regarding not proceeding with the RFP, I will tell you I feel very uncomfortable with that, because when the board approved that, Measure B wasn't even part of vocabulary. And now Measure B is part of the vocabulary, and that's where the funding would go for the brick and mortar. And it's taxpaying dollars, and this certainly, as much as we try to be transparent on this, we would be taking a step backwards if we sole sourced it without going out to RFP. Now, the truth is, we'll probably only have one organization, or maybe 2, respond to the RFP. But I would feel very uncomfortable going without the RFP. Anybody else want to chime in? Mark?
Janine or Carmel, if you could help me with this, but Howard Hospital before Measure B was designed with a general contractor to provide a puff unit, and the other portion again is, we talked about it, I don't want to mess it up, so.
Residential.
Residential what?
And then I'll the rehab center, which is a residential boarding care, generally focused on LPS conservatorship clients.
Right, so these things are different than what the CRT and CSU are. But when we look at the gamut of what the Kemper report says, each of these things are important. And from our standpoint, we're struggling with yes, we'd like to have all of them, but do we have the money to build and support them? But in order to find that out, I think we have to spend money to find out those answers. And I know there's people here from Willits that don't want any type of mental health facility, but we haven't even seen if we could have anybody staff that facility. So one thing that I can say is that Measure B was sold to the community for a puff unit, and we can't ignore that. And I would be in support of asking for an RFP to use that. I'm not sure what the funds are to create an RFP to use that facility as it was designed by the general contractor. That is not a motion.
Hold on one second, Doctor. Jen, you're up.
Yeah. So I'm with my fellow board members in saying that we have some general agreement, I think, on the areas that we want to recommend to the board for funding of Measure B monies. There were 4 that came out of the Kemper report that I think have been discussed and are on the table today. So one was the expanded outreach of the mobile unit. We talked about that. We made some recommendation. The third one was crisis stabilization unit. Second one was crisis residential unit. Those have been discussed. And then the first recommendation was some kind of an inpatient psychiatric. To me, before I can recommend to the board or as part of a specific facility, my thinking first goes to the need. So if we're talking about the need for a psychiatric inpatient care, which is, I think, what most of us in at least mental health feel is one of the high priorities, then we have to figure out what are the options. That's what I think about. What are the different ways we could provide that care? And I go back, I reread both the Kemper report in anticipation of this meeting, and also there was a supplemental letter that came from Kemper following the submission of the report. It says follow-up to August 29th, 2018 presentation. And what he said in that, this was under number 3 in the point from the letter, comparability of costs for PHF construction. And it said during discussions with Measure B committee, it was reported the estimate of $11.2 million to $14.9 million for rehabilitation of the old Howard Hospital building included costs for 2 facilities, a PHF and a separate psychiatric rehab facility. To enable an apples-to-apples comparison of the estimated PHF construction costs, this estimate and the estimate we have provided in our report, we recommend that the Measure B committee ask the Howard Foundation for a revised proposal from Heller & Sons that shows the separate costs of construction. So that's one of the points of information that I think we need. We need to know what, if we were looking at the old Howard Hospital as a potential psychiatric inpatient facility, what would the costs be that are comparable to other costs? Then one final thing I draw our attention to was in the original Kemper report, said there were 2 options for Mendocino County to expand inpatient psychiatric bed capacity in the county. One option is for one of the local hospitals along Interstate 101 corridor to build a new wing for psychiatric beds. And we had some input from the Adventist Health about that. The other option was to either build a separate facility or to rehab the old Howard Hospital to do that. So it seems to me those are 2 possibilities that are on the table. One is to know whether the Adventist Health is wanting to build additional beds. The other would be, could we rehab the old Howard Hospital facility for an inpatient psychiatric? And it seems to me the way you get there would be to put out an RFP or whatever you would do that to get actual bids for, the building of that to see what the interest actually is. Then we would know, it seems to me, what actually is out there as potential solutions to the problem that we could then vote on or recommend to the supervisors. So that's what I would like to see is on this item, is that we get an actual bid back from the Adventist Health as far as rehabbing the existing hospitals along 101, and a bid back from whoever at the old Howard Hospital, Adventist, or help me out,
Helmer and Sons.
Right, for the foundation to see what their recommendation would be for the kind of comparable beds that they might recommend.
But I think the foundation's already paid $50,000 for this thing, and they don't want to run it. So I think I kind of know what their answer would be if we said, will you spend more money to tell us how much it's going to cost to fix your building? But that's up to them, not me. Hold on one second. Dr. Barish had a question.
Again, you know, I agree with you. I mean, I think that we need to discover how much this would cost in all of its forms. And I think each project has pluses and minuses that are significant. The project at Ukiah Valley for a lock facility would be the least expensive. It would be the quickest to go forward. It's already OSHPAD approved. The downside is there really aren't enough beds. 6 is, my understanding is it would be $4 million for 6 beds, $8 million for 8 beds. You know, because if you go over 6 beds, you'd have to do a major renovation. And 6 beds, so it's still on the low side. The idea of building a new construction associated with the new Howard Hospital and having a psych hospital, the limit would be 10 beds for a critical access hospital. You know, that would be great. I think we're at least 6 years out to get that done. So that would take a lot longer to rehab. To rehab the old Howard Hospital. I mean, I think I've been a proponent of that for 10 years. The downside of that is that it's a huge facility. It couldn't be used just as a PUF. There are too many beds. So, and this rehab, my understanding is what this is we have a lot of gravely disabled people that have conservatorships in Yuba City, etc., all over the place. It's very expensive for us. It'd be nice to bring them back to Mendocino County. That's what that would do. Would be, and the virtue of that, it would be also locked. So, and the thinking there is that the city of Willits would be, you know, they wouldn't have to worry about people walking out of the facility. The psych patients walking out of the facility because they would be locked. But all of these things require a lot of debate, I think, and a lot of questions. The question also whether OSHPAD is the state board that is responsible for what kind of construction you do on hospitals. The question is the old Howard Hospital OSHPAD exempt or not? And there were, you know, when we were pursuing this years ago, there were varying opinions about that. My own feeling is it's probably OSHPAD exempt, which would make it happen more quickly, but I think a project of that scale, it wouldn't happen quickly. I think we're talking at least 5 years there also. But anyway, so just to summarize what I think that the issues are with locked facilities, either psych hospital or psychiatric health facility.
So just so I understand, you have an idea how we get to there to be able to get those questions answered that would, to being able to evaluate the choices that we might have for a inpatient locked psychiatric facility to see, you know, as the sheriff is saying, where we either think it's possible or to say there aren't other options, this is the only options that are actually available. How do we get there is what I'm asking from your mind.
Well, I think my own feeling, you know, I'm not a mental health provider and I don't, but just my own opinion is that probably the cost benefit of a locked psych facility in Ukiah Valley Medical Center is probably not going to be a good option, you know, just because of the number of beds and how much it costs to build and how much money you can bring in with such a thing. I think that it requires having more beds than that, just to make it pay, at least come closer to paying for itself. The other two are more difficult issues, you know, and again, I think that regardless of what we do in a community, like for example in Willits, we have to bring the community on board to what, you know, the city itself and the citizens, you know, So that's an issue. I think that my own opinion again would be that if we had a locked site facility associated with Howard Hospital, that would be more palatable than having old Howard Hospital be renovated. Although personally I would, I think we would gain a lot of extra space that would probably be useful, but I think that's another debate is, do we need this other locked facility? And my own feeling is I think that it would be very useful, as I said, to bring people from other counties and save a tremendous amount of money on paying for conservative. But then we still have more room. What are we going to use that for? Would it be acceptable to have someplace that's not locked in the city of Willis? But I mean, I think that's where a lot of this debate comes from. And I don't think it's very easy to do. I think it would be, my own feeling is it would be easiest to eliminate Ukiah Valley than the other two possibilities.
Carmel, do you have a question?
I have some comments.
You're up.
So many comments have been made by the members of this committee. I think they're all good comments, and there's merit in everything that's been said. What I look at is that, really what is our charge? And I think for the last 11 months, one of the issues that I've had is that, Measure B is not, I don't believe Measure B is as expansive as we're making it. I think that there are many times that we're sitting here talking about issues and attempting to make decisions on those issues that really should be the Behavioral Health Board or somewhere else. So, again, the reason I think we need an attorney is we really need someone to keep us on a path that will allow us to be focused enough to do the job we're supposed to do. And I'm not quite sure we're there. And so, if you look at what we've done and all of the efforts that we're talking about, Howard Hospital, that was a board directive over the last few years.
Wait, old Howard or
the old Howard Hospital has been a board directive. This is what Tammy's been working on, Janine's been working on, I was working on, and what we worked on with the foundation. And we didn't get to the city because we weren't there yet. We were not in that position to get there because we didn't know if we were actually going to utilize the old Howard Hospital or not. Once Measure B passed, that all changed because there really could not be a commitment from the county until the Measure B committee came together, worked on this, and made some recommendations. So, yes, Howard Hospital is still on the table. I will also say that there were many reasons why we were looking at Howard Hospital. And it's a great location, everything we all know. I don't have to go into that. I think another effort that there has been much county focus and a lot of work on is the Crisis Stabilization Unit and Crisis Residential. And I would ask that at some point that Tammy Moss Chandler be able to make public comment and talk about this. The question that I have is we talk about Howard Hospital as a PUF unit, we talk about Crisis Stabilization, Crisis Residential. I'm not exactly certain what the county's commitment has been to not only Redwood, but the effort around crisis stabilization and crisis res. And so here we are now, Measure B is embracing this. And I'm not quite sure what the county commitment is outside of Measure B, because right now Measure B doesn't have a commitment. So what you're saying, when we talk about doing an RFP on this, I'm not certain what we should be doing. And so as the CEO of the county, I'm confused about this, so I don't know if anybody else at this table understands what we should be doing. And then now we have Measure B, which really is something that, as either Jed or Mark said, this is an effort of the people. It's not the board, it's not us, it's not the sheriff, it's not the county administration. This is what the people have voted in. And so what we need to do at every meeting really is stay focused on what our charge is with Measure B. On top of all of that, we do the Kemper report, and we have a great report. We all agree on that. We have these great recommendations, and I don't think this committee in total has decided what we even want to do with the Kemper report. So we do this report, we have these recommendations. Are we even going to totally review these recommendations and follow them? And I don't have an answer for that one either, so I don't know what we're doing. So we could all sit here with great recommendations that we want to make to the Board of Supervisors, but one, we need to really look at what our charge is with Measure B and stay within that. and then make those recommendations. And also, we moved forward, and this was the sheriff who really wanted to see the Kemper report as a gap analysis, which I think is a great idea. And here we are with this report with these recommendations. Jed, you brought them up, but I don't think there's a commitment from this committee in total to really look at those recommendations and determine if we're going to move forward with those or not. So, I sit here and really wonder, how we're going to proceed. We have a great committee with good people who want to do the right thing. We're all on the same page with the vision that we have for this county to improve mental health services, but I'm not certain that we have the focus and the direction. So when you get back to B, which is what your original question was, I think that when we talk about the old Howard Hospital, I'm not sure with every one of these items that we can talk about them individually or in total, and maybe there's something we should be talking about first, and I don't know. I would say direction at some point, and I think someone brought up the fact that the people voted for Measure B because they wanted a 24-hour acute care psychiatric facility. And so if that is our charge, then that's really where we should be staying. And then in that case, the old Howard Hospital is very much appropriate to be on here to discuss. So, and we keep coming up with all of these other options. And I'm not sure that, that what this committee's charge really is with crisis stabilization and crisis res. And I really at some point would like to hear from our county staff on that as well.
And I understand that, Carl, but as long as we have options on the table, it's very tough to prioritize and move forward. What I'm trying to do with today's agenda is to remove items or prioritize items so we can actually make progress. Nobody wants to come to a meeting for the purpose of having a meeting, but that's what we've been doing.
And you're right, we've done it for 11 months now, and all I'm saying is that without having some very specific direction, which is maybe what you're trying to do today with this committee, but without some very specific direction, these topics are going to keep coming up. And so I'm not quite sure how to get there, but I support what you're trying to do. I'm just not sure we're going to get there like this.
Dan.
Yeah. I agree with everything that's been said, and I'm sorry I can't be more diplomatic in my speaking. We need lots of information, and I think one of the issues is that we have this wonderful report, but we haven't spent any time studying it. The Behavioral Health Board, on the other hand, has spent hours studying it. So we have some specific recommendations in addition to the recommendations of the Kemper Associates. I think that our board, our committee, needs to do that since the Kemper report was created for us. And I know it's difficult on how to do that, the process, because we read it, but then how do you go about organizing how we talk about it, which I put in the last set of handouts Dora did, an idea on how to study it, because it was difficult for us, and that's what I learned how to do it. So what we figured out was that before we can talk about putting out RFPs, requests for proposals, we need an RFI. We need requests for information because we need to know these different types of facilities. We need to know the staffing it requires. We need to know the cost. And that comes before we put out requests for proposals for specific projects that we haven't even decided what we are looking at. Also, what I've noticed here and also at our board is that we've had people come to us with specific ideas, and they particularly come to this board because it has money. People don't usually come to our board because we don't have any money. But I think that we should look at other venues besides the people that are right there waiting to take the money and see what is appropriate. Because even though it's taken us a year to get this far, we have accomplished things. We've set up our structure. We've heard some presentations. We're right now figuring out what we're supposed to be doing. And this is good because we have one chance to do this right. We're only going to get this number of $1 million once. And if we don't do it right the first time, Mendocino County has a reputation of not doing things right the first time. This is our chance to do it well and do it right for what's needed. So I think studying the Kemper report in depth And I mean, that could take hours in itself. Would be a good direction for this committee to take.
So can this board look forward to the list of priorities that you stated the Behavioral Health Board has?
We don't have it set in priorities, but yeah, I'm gonna type it up. We accepted it and we're gonna send it on to the Board of Supervisors. So I can put it to your committee next month if you want.
With the understanding that this board isn't going to be charged with the recommendation to the Board of Supervisors of any specific type of treatment for psychiatric patients, but more in line of the brick and mortar of how to build something or where to build something, and not micromanaging the Department of Mental Health of providing the treatment, right? There's a big difference between the Behavioral Health Board and the Measure B Board. The Behavioral Health Board talks about the services provided, as in we are charged with the responsibility of building or spending money so we can have a location where those services can be provided.
Right, well, it's all part of the big picture.
Understand, but there's still a separation in responsibility.
So, I mean, we just make recommendations on everything, so.
Okay.
We made recommendations also on facilities. So, for example, that was the first one, put out a detailed request for information. And then we also recommend that the multiple use facility consolidate staffing needs that has been presented, that idea. That's the kind of stuff that we talked about.
Right. And so, I'm not trying to belabor it, but has the Behavioral Health Board discussed any brick and mortar that we could look at?
We have discussed locations. We have not.
Okay.
Yeah.
Okay.
We're just commenting on the recommendations of Lee Kemper, which we really need to study here.
As long as it doesn't change what our legal responsibility is of how it's laid out in the initiative that the voters passed. Janine, did you have a question?
Yeah, I was just gonna add on to Jan's, that the part of what the Behavioral Health Advisory Board was looking at was they didn't want to have a specific site. They wanted part of the RFP, RFI process for outside people to look at alternative sites, to present to the county alternative options for sites and locations, and then what they would do and what it would cost and what they could bring to our county. So that's kind of when they talked about the RFI. Wasn't, we want to just look at this site. We want to see what anyone can bring and what that would bring to our county, what would they build and what would that look like. They also, and Jan didn't read it, they really talked about not just PUP, but pre-crisis and crisis. They wanted it to look at the whole crisis system in the sense of pre-crisis and crisis regarding when they were looking at what types of facilities could be brought to Mendocino County or are already here that could be built for our need. I wanted to agree that I think we spend a lot of money for the Kemper report, and I don't think we've really evaluated at the level we could have. Kemper made some good recommendations, and I think we should look at why did he make those recommendations. We had him evaluate our county for our need, and he made those recommendations specifically. And so I think that's something that I would like us to see a little bit more on. I also think we don't have a lot, we have some data, but we don't have a lot of data. So we're talking about types of facilities. We all don't even know all the types of facilities. We don't know what our current data is. I did bring with me today, and everyone should have it, and there's some on the back table. This is what we call our data dashboard. We get this monthly. Yes, our Behavioral Health Advisory Board does look at it, but it lets you see our system of care. When we're talking about a PUP, how many people did we hospitalize in the month of October and year to date? When we're talking about crisis stabilization, crisis residential, how many crisis calls did they get? How many crisis assessments did they get? What could those numbers look like if we had those facilities within our community? And then how do you fund those facilities? Because Measure B cannot fund everything. We'll build it, but then we have to fund it long term. And what does that look like? So I think some of that, as we go through the Kemper report, allows us to look at our full system and see as we're making recommendations what that looks like. And I know Tammy might talk a little bit on the CSU and CRT. I will just add that the county has a grant that we applied through for the state of California for to build a crisis residential treatment center that was originally started, and then it transferred over from Warner Management Group to Redwood Community Services, and that did go in front of our Board of Supervisors for approval to accept the grant and to work with Redwood, and that was also approved by Department of Healthcare Services that the county could work with Redwood to build that property for crisis residential treatment services. And at that point, they had established to add a CSU to that. That's been in the works with them for, I think, approximately 3 years. The grant does expire in May of 2021, that we have to get something up and running or we'll lose the grant funds for that. But it has been a priority in our community as a pre-crisis service. It's been on our Mental Health Services Act projects as something we wanted to roll out, and there's been some Mental Health Service Act funds dedicated to operate that so that we can have that within our community.
Any other committee like to weigh in?
Mark. Getting back to what Jed mentioned, we do have numbers on what it would cost to build this facility. They're old. The construction numbers are old. It was around $14 million to build the facility that was here. The county requirements, they're all over the board because we can't get a straight answer from the county council as far as what we can do with that contractor. But I think we'd have to add at least $1.5 million to hire a architect and consultants to approve a design that you would send out for a bid. So you're looking at $16, $17 million in reality to renovate the Howard Hospital. So those are relatively real numbers right there. The CRT, CSU, the last I heard, and these are general numbers from Camille, $4.5, $5 million to build that facility. They don't have a working design and they're going to need money to complete that design. And they're probably going to have to send that out to bid, competitive bid as well. So those are real budgets that we have within the Kemper report. All of these facilities that we've talked about are prioritized. It's up to us to decide which and what line that they will go. And it's if we can afford them, to operate them. And, you know, right now we had a report from RCS and RQMC that it's a $500,000 support, ongoing support for them. They didn't ask us for a certain amount of money for the building of that building. The tough unit and the long-term stay at Howard Hospital, or Old Howard Hospital, might pay for itself. If that's a 32-bed facility, if we could keep that, you know, occupied and make it qualify for Medi-Cal benefits, it could be a positive for a contractor that submits a proposal to us that they could make money. We renovate that facility, and that could be all we're asked to do. And if you look at it that way, we've got plenty of money to do that. Anyway, those are my comments.
Any committee members have any more comments? Ross?
So this is more of a question than a comment, is that I don't think I know if they're going to, the Howard Foundation is looking to donate the building or sell it to the county. You know, I think we need, I don't know, is there anybody here that can answer that?
Wait just a minute. Yeah,
so we need to understand that.
Okay.
And frankly, before I think Mark's exactly right. It's going to take a lot of money to actually do the design. You know, to do an engineer's estimate, that's one thing, but that's peanuts. You know, it's a lot of money to do a complete design. And I mean, frankly, I think I'd be lining up an auction on the property first. And one thing, you know, you're saying, Mark's saying that it's going to be more expensive because we need to put some money in for doing the design work. It's going to be more expensive because right now contractors are busy and you can't get stuff done. If we actually started building right now, good luck. You just can't find it. On a project I'm involved in, put out an RFP for design. And we had one respondent, you know, and usually there's 5, right? There's just, everybody's busy.
I agree with that, but we have to start.
That's true, but I
need that first step.
We need to make sure that we lock down ownership of the property and know what it's going to cost us.
Sure. So, any other committee member comments, questions? Yeah.
One quick one. I agree with what Carmel and a number of other people have said, is that in order to move ahead, and I think we have moved ahead, I don't think we've just been sitting, spinning our wheels in these 11 months. I think we've accomplished quite a bit. But to move ahead to the next phase, it seems to me, one, as Carmel says, we have to be very clear what the guidelines are under Measure B, so that we don't get a field of all the other possible things that we might or could do. I think we always have to be sure what we're doing and the issues that are coming before the board fall within the purview of what we're being asked to recommend. Having said that, I think most of us read the Kemper report in detail. I feel I spent hours and hours of it. I don't know how it compares to others, but I spent a lot of time with it. And my understanding of what Measure B, the focus, in addition to the training program, which is kind of a separate thing, in terms of services, it seems to me that the three main recommendations that came out of the Kemper report all relate to each other. They deal with crisis stabilization, crisis residential, and inpatient psychiatric. And it seems to me we have to address all three of those things together because they interrelate with each other. Something like the outreach mobile unit relates to, but it is separate enough. I don't think you have to wait till everything else is in place before we can make a recommendation on that, which we did last meeting. So I think there is enough guidance to that to say those are our three priorities right now that we need to address. And what Jan's saying, if there's information we need in order to make any recommendations on any of those three areas, I think we need to get those questions answered, and then we can make recommendations. And there's some pieces that are missing that we don't know that would enable us to recommend what we want to do to move ahead with those three, I think, interrelated issues. So I think we've got some guidance and some direction, and we need to solidify that so we can really see that as a charter for this group to move ahead with, so we know each month we're going to accomplish a little bit more of that, and decisions will be coming out, each month, hopefully each meeting, that will advance that whatever way it is. And the community hopefully can know, here's what we're working on, this is what's coming up, and can get an idea that we in fact are going to be making decisions, and the board can know, here's what's coming your way. They will know what we're working on and where they're likely to be hearing a recommendation on specific guidelines that we want to request consideration for funding.
My response to that, this committee's made less than 5 decisions this year. We've decided to do the Kemper report. We've decided to reimburse the elections department for the election, and we've decided to go to MOPS. And I don't think we can pat ourselves on the back for a whole bunch of decisions that we've made, because we keep asking for information. And if you feel my frustration, it's only because I'm frustrated. I'm hoping that this committee, one way or the other, and using Jed's words, can make a decision. If our goal is to make one decision a week or month, then I wonder what our decision is going to be today, instead of wondering if we can get more research done. Dr. Barrett.
I agree with Jed on the fact that the Kemper report identifies priorities in terms of crisis stabilization, crisis residential, and PUP. I don't want to see crisis residential and crisis stabilization tied to PUP, because one, the PUP or the psych hospital, depending on what we decide to do, is a much longer process than crisis residential and crisis stabilization, and crisis access for that matter. But I agree that these have been identified as priorities. Like Janine said, the county has already entered into this construction of the crisis residential, crisis stabilization, crisis access. And I think that your suggestions are well taken, that we don't know the exact cost, but like you say, that to determine the exact cost, we're gonna have to, or somebody's gonna have to spend more money to get the complete architectural plans done. Camille has come up with an amount that she's estimated that it's going to cost. What we could do, I mean, I would like to see us move forward on at least this construction, because Kemper agrees. I think most people, the state agrees that this is high in priority, and the fact that we can get this done, and it's good for patient care in terms of getting people in crisis upstream from a locked facility. It's good for time because it's much quicker to build. It's not hodgepodge. It's good for money. And again, I think that this could be one of the things to determine is whether the in-house construction team at RCS can actually go forward and build this in a much more timely manner and much more efficiently. And as far as the total, we can have an agreement that at the end of the complete architectural plans, that a third party will look at those plans and determine whether that's going to come in below what Camille said or not. And if it doesn't, then we can talk again. But I think that you can't get to one without the other. So I think that I agree with Tom, and I would like. To me, it's fairly apparent that this is high on the list, if not first on the list, which is what Lee Kemper himself said. And I would like to see us proceed. I think that it's a clear front runner as far as projects for many reasons.
Anybody else wants to comment? Okay, open up to public comment. Please state your name and your statement. You have up to 3 minutes. Thank you.
Good afternoon, members of the board. My name is Richard Matins. I'm the Executive Director of Consolidated Tribal Health Project. And I've been on the periphery of this, listening at multiple meetings and hearing what all this about the report and everything. I guess I couldn't agree more about the need for priority setting and allocation process. And my input is, if money is the concern, I'm willing to help facilitate something like this. I've done this for several years throughout my career in Baltimore and in North Carolina. If that's what y'all need to do, it sounds like y'all need a formal process to make a decision, prioritize what you're going to do within the construct of Measure B, okay, and everything involved in it. But I just want to put it out there, if y'all are, I may be naive, but if y'all are willing to, I'm willing to help out with that process should this group want that. Thank you.
Thank you very much. Anybody else would like to comment on item 5B, hold our hospital discussion possible action? Yes, please state your name.
Josephine Silva, Willits. I would like to say that I think that we need to study further possibilities and combinations of things. One of them, the old Howard Hospital, doesn't necessarily have to be just a PUF unit. It could also have a board and care associated with it. And recently I looked at, or started talking to Janine about how many people are on board and care and what is that the cost to the community. And most of the conservatorships are on, at one time or another, on board and care in various places around the state. The current board and care, Redwood Creek, the Ortner group is importing their own people to stay there rather than Mendocino County people. So, and that cost to the county is 2.3 million a year. So we could, if there was a 16-bed unit that was Medi-Cal certified, we could certainly recoup some of that money, which is important because if someone is in need of services, they start out perhaps with a call, and it goes to the crisis stabilization unit. And then from there, it could go to a family member, who would take care of them, or a 5150, or a crisis treatment center. Or there's other options, but those are the basic ones. And then, if they're in a crisis treatment center, or a 5150, after they go there, they might come back to a crisis treatment center. They could be there for 30 days. Or 5150 might go to the family member with some help from the county. Anyhow, from the crisis treatment center, after 30 days, they could either go back to their family, a private living situation, or more likely to a boarding care. And we don't really have any boarding care. So when you're talking about, oh yes, we're going to cut our 5150s and we're going to use crisis treatment centers, then it means we need to spend some money, which would be a facility, down the line for boarding care. I just want to put that out. that Howard Hospital may be studied for additional facilities.
Okay, thank you. Who else would like to talk about this agenda? John McCowan.
John McCowan, and since you're going to make recommendations to us, I'll try not to be too specific in making a recommendation to you.
You only have 3 minutes.
Well, I think I only need 2. So I think it's a bit cart before the horse to be deciding where we would put a facility. I'm not sure the committee has yet clearly recommended these are the facilities we need, but I think that would be the first step, and I think the Kemper report did provide an outline through a series of recommendations, and I think you could just go down those recommendations, and we either support this recommendation or we don't, and here's why. And then once you have determined these are the facilities that, budget permitting, we would like to see constructed, then I think perhaps you go into more detail about where would you recommend facilities be located. So thank you.
Thank you very much. Anybody else? Mr. Cameron.
I'm Bernard Kemeroff from Willits, and I've been following Measure B closely for the last 9 months. And I want to say I agree on this issue completely with Tom Ullman. I think it is time to make a decision about Howard Hospital, because I think everybody realizes that this is a huge weight that's hanging on this whole committee, hanging on so many people that are showing up every meeting, because once you make a decision, I think about Howard Hospital, a whole lot of the energy is going to get consolidated a lot better, and I think you can make better decisions. And some of the things about the old Howard Hospital and Willits is, and this is stuff from the Kemper report and stuff you've heard before, of the patients, the clients, whatever you want to call them, 12.8% of them come from Willits, 55% of them come from Ukiah, the rest from around the county. The contractor that Howard Foundation hired, they gave a $14 million estimate. At that same meeting, somebody in your committee asked him how firm that was, and he almost laughed. He says it's not firm at all. He said he has no idea what he's going to find when he gets into those walls. The city of Willits itself, at city meetings, has different opinions about the legalities of things like OSHPD, and whether that building is or isn't exempt from it. The fire marshal of Willits Valley has stated there's major water issues with that, and the police chief has stated to you that Willits does not have the services, the ability, the fit personnel in case of emergency situations.
Willis is a poor town. We do not have a major rescue operation. We have a volunteer fire department. So when people talk about, I just heard talk about the cart before the horse. We've been hearing about, ever since I've been here, I've been hearing about the cart before the horse. I think that Howard Hospital should be voted on now because I know it is time to consider the fact that it is really a very poor location for that kind of operation. The building is 90-some years old. It's questionable whether it'll ever meet code for any kind of money that can come up. And I urge you to take a vote on it today so we can know where we're going. Mr. Myrtle, I think, mentioned earlier that Measure B was sold to the community as a PUF unit. And maybe that's so, but if you read Measure B, it doesn't say anything about a PUF unit. It says mental health, and that's for a huge area. Thank you.
Thank you. Who else would like to comment on this, please? Arnie.
Arnie Mello, CEO of the Frank R. Howard Foundation. It's been a while since we did that report, Mark, so I'm not 100% sure of this, but I can call Doug Helmer this afternoon and get an answer from you guys this afternoon. My understanding is that the estimate that was provided was for a design build contract and that it did include architectural services. So I'll find out for you for sure. And I'll email you.
Could you answer the question regarding the cost of the building?
Yeah, well, yes and no. I mean, I can't speak for the board. That's a decision that they would have to make. But yeah, I think that they would give it to you. And if you need it, if you need something in writing, I'm sure at some point we can provide that to you. But I will say, I think in part it's going to depend on what you decide you want to put in there. I know we've had some conceptual designs about what we would like to put in there, but that was before the Kemper report, and you guys may decide that to effectively utilize the square footage appropriately, you may want to put in different services. So, so I think it'll depend on, in part, what you decide you want to put in there, and what kind of community support we will have for whatever it is that you eventually decide on. Because at some point, I know there has not been a whole lot of communication between the county and the city, and it has been frustrating for some on the city side that this has been kind of held over the top of them for so long. But the truth is, none of us can really make a decision, I don't think. And before we know what it is, we'll go in there and have the county and the mental health services provide an explanation and create a dialogue between the county and the city about what the proposal is and how will this affect the local community and how has this worked in other areas. So we haven't got that far down the road yet. But at some point, we're going to have that conversation. And I think what we're willing to do and what we're not willing to do will depend in part on how effective that communication is and how receptive the city and the community is to what you propose.
Sure. Could I ask
Yes.
if any information that's sent be sent to Dora so the whole committee has it?
Okay.
So that would be the Measure B email address.
Thank you, Sheriff. My name is Tammy Moss Chandler. I'm the Director of Health and Human Services for Mendocino County. And I just wanted to provide a little bit of clarity on some of the county's work over the last 5 years that is specific to crisis residential treatment facilities, as well as the partnership with Howard Hospital Foundation that predated Measure B. So certainly Behavioral Health and Recovery Services and Health and Human Services has known for many years what you all are here for, that there are not enough local facilities to provide 24-hour care in Mendocino County for people who desperately need it. And so we've been working on plans of where might there be those kind of facilities and what might there be without a lot of funding available for that. So one of those proposals is for a crisis residential treatment facility that Dr. Miller talked about briefly, was a grant through the mental health wellness grant system called SB 82 that was applied for several years ago. What I want to make sure this committee knows is that the funding that was secured was only $500,000. So $500,000 is not enough to build a crisis residential treatment facility, but the county did accept that, and the Board of Supervisors approved acceptance of that grant with the commitment to look for additional money to fulfill and build out what we know is a need here in Mendocino County, and what could certainly be sustained by the level of service delivery that's needed in this county if there was such a facility. The other thing that we looked at closely was the need for inpatient hospitalization. So crisis residential treatment services are for what Janine called earlier pre-crisis. Someone might wind up there in crisis, but they aren't at the level that they need hospitalization, psychiatric hospitalization. So there's only two ways we get psychiatric hospitalization in California. They're through a PUF facility, sometimes something bigger than a PUF, but it's still inpatient, a private inpatient facility, but those facilities don't take Medi-Cal, which is the county's primary funding source. And the other option besides a psychiatric health facility or inpatient health facility is a hospital that has inpatient beds. So that's why Lee Kemper puts those things together. They're a person at the same level of crises. Those are really just our two options of what we have in California to put people at that level of psychiatric 24-hour need. So certainly we're looking at if we could get that kind of facility closer and ever could find grant or funding, that would certainly be valuable for Mendocino County. So of course we are very excited and supportive of Measure B's work to develop those facilities here in Mendocino County, and to really look at that pre-crisis need for crisis residential treatment for people in crisis, that we have a crisis stabilization unit where people can stay for 24 and maybe someday soon 72 hours. But that's really just to assess someone and then decide, can they step down to something like crisis residential treatment, or do they need to step up into longer term locked facility that's a hospital-sized hospital locked setting. So, and then certainly we need post-crisis care for that long-term care for particularly vulnerable people who need a place to live 24 hours a day, but they're no longer in crisis, but they need additional supports. So I just want to offer as HSA director to work closely with the funding we've already secured for crisis residential treatment funding, which right now we are doing in partnership with our administrative services organization, RQMC, and Redwood Community Services, to make sure that that we can build on that. And I actually just want to offer that I really do believe that B, C, and D are all related to work that we either have to determine if there's any way to sole source based on efforts that started, like the Crisis Residential Treatment Program, to build on what we've already funded and established in our Mental Health Services Act funding, and that all the rest we are ready to help poise and support this board with developing an RFP for all of those services so that you really can have the information that you need to make next step decisions. So whatever we can do as Health and Human Services to support this work, we certainly want to do that.
Thank you very much. Jerry Gonzalez.
Jerry Gonzalez from the city of Willits. First of all, I want to thank Arnie for kind of putting it out there. I've just kind of been sitting back and yes, we have our questions, but I think up until now we haven't had a project. We haven't had any dialogue either, but we haven't had a project either. And that's the important part, that whether the committee recommends to the board to go forward or not, I look forward to working with the county, or the city does, and looking at whatever project is preferred, if that's chosen. But we do welcome the dialogue, and I'm not going to oppose or propose a facility because I haven't seen anything yet. I do hope when the time comes, if you do proceed with Howard Hospital, that everybody takes into account the sensitive receptors and the needs of our community, and also any mitigation that needs to occur depending on what goes in there. I had past experience in my past job with the prior contractor. I was not happy, and obviously there lays my I guess trepidation with whatever goes up there, if it goes up there. At the same time, I know that the foundation needs to do something with the property, and again, I look forward to seeing it and working with the county, whoever.
Anybody else like to comment? Any committee members like to weigh in on anything that you heard that you want to respond to? Carmel?
Sure. The first comment that was made, I think, is from Shannon, and Shannon's first comment was about a strategic plan. I'm not certain that the concept of a strategic plan is melded with the Kemper report, if that's what you were thinking. But I'm not, that may be something we want to just discuss with this item. I mean, if you're taking a strategic plan, like 5-year strategic plan, 10-year, just kind of like what Lee Kemper already did in here. He did 10 years for the financing. If we had a plan, would that assist us in staying on a path, whether it was including just the PUF or talking about crisis stabilization or what? But I didn't want to miss that comment because I thought it was a good comment and we just brushed over it. So that's all I wanted to say.
Thank you for bringing that up again. Yeah, I think the Kemper report provides a really solid analysis. I don't have the expertise in mental health that some of the other board members do, but it actually lays out a 10-year financing plan in here. I mean, I think the steps are fairly simple if the board is in consensus that this is the path we want to follow, but it's so important for the community and the providers and everyone to have a transparent path forward that we can put out there so that we're not just pinging off of all these ideas. And I feel like all of the points made today have been really, really valuable. But yeah, there's a severe lack of focus here. And a strategic plan, whether we say that the Kemper report is our plan or we come up with something that parallels this, I think that would give the public assurance that we're following a path, and it would give the committee some focus so that we could move forward with that. Because I share your frustration. I totally get it.
Any other comments? Okay, so item 5B was use of Old Howard Hospital, discussion possible action. Is there anyone who would like to take action? Moving on. Okay, item 5B C is in Charles, advise the Board of Supervisors to release a request for a proposal RFP for a bid for psychiatric health facility, crisis stabilization unit, and I'm sorry, there was a mistake in the agenda. Instead of the word or, it should be and crisis residential treatment facility for Mendocino County with discussion and action. This is very similar to what the discussion we just had. In other words, where are we going? Are we going to push for an RFP? Or are we going to continue to ask for more research? Let me tell you what's going to happen next month. Next month, somebody from this committee is going to be elected chair of this committee. We rotate every year. Whoever that is, I would welcome you. I would welcome you to, it's going to be on next month's agenda. I would welcome that person to look at what we're trying to do to get action instead of asking for more research. So item 5C, I've read it. Is there anybody who would like to comment on 5C? I'm sorry?
No, it was off topic. I just wanted to, because the sheriff was very good about making sure someone got reelected each year so that we could all have our peace. But by the policies and procedures, it's the vice chair who steps in, and we elect a new vice chair. And that's how our rules of procedure are, and that's so that the vice chair has a little bit of experience before he steps into them big old shoes.
Look at you paying attention.
I knew that. I just wanted to break it to Dr. Very, very gently. I'm sorry.
I'm not so gentle.
Is there anybody who would like to talk about 5C in Charles, or yes, Dr. Barry?
I would like to make a motion to advise the Board of Supervisors to release a request for proposal for the Orchard Avenue project, including crisis access, crisis stabilization, and crisis residential treatment.
proposal for construction or for design?
Well, you know, and again, I think that this can be tempered by the idea that we're, you know, I know your understanding, I understand your concern and Mr. Myrtle's concern that there could be cost overruns and it may not stay within the budget, but I think that we can include in the recommendation that the first step is to move forward with complete design, and then on the basis of that design cost, you know, and then I think that we, you know, if it's agreeable to move forward with the estimate given, then that would be taken care of. But if not, then we have to talk about it some more. If it seemed like it was going to be different than what had already been proposed.
So your motion is to recommend to the Board of Supervisors that they put out for request for proposal.
If such a thing is necessary, you know, and that's another question, is whether we even have to put out an RFP since this has already been approved. But,
well, like I said, in my opinion, it is because there's, when it was originally approved, there was no Measure B money.
Right. Okay.
So that's the major funding source of the building. So, okay, so there's a motion on the table.
Could I, I was just going to ask you.
Can I ask for clarification? Okay, so, recommendation to the Board of Supervisors to release an RFP for the Orchard Avenue Ukiah project for CRT, CSU, and crisis access. Thank you.
And, you know, with the understanding that it falls within the budget, and if not, then to revisit it. Because we can't know until the money's spent on the plan, on the architectural plan.
Okay, so there's a motion on the table regarding Orchard Avenue.
You need a second to the motion. Could I ask, please, for her to reread that motion, please?
Oh, Lord. Okay, so the motion to recommend to the Board of Supervisors by Member Barish to recommend a release of an RFP for the Orchard Avenue Ukiah project for crisis response.
Crisis access, crisis stabilization, and crisis residential.
Residential, sorry, about that word, okay.
Specifically Ukiah, you stated?
Specifically the Orchard Avenue.
Orchard Avenue, right. To complete the design and cost based on design to construct.
I don't know what crisis access is.
It's different. Sure, I just want to make note that what the item is and what the recommended action are not quite the same. So I don't know if that's intentional or not.
Well, the item talks about crisis stabilization and crisis residential treatment. It doesn't specifically talk about the building that's planned, which also includes crisis access. Which would be, well, that's, I won't get into that.
Your motion also, though, lists an actual location, and so that's just not part of this agenda item. So, I mean, honestly, for Brown Act, I don't know.
Right.
I mean, I don't know that.
So, Dr. I believe your the motion would be would fall within the parameters of the law if you remove the specificity of location and address. But if it was for an overall package deal, RFP for a package deal, I think that we're more in lines of opening up to many other opportunities, because another third party would say, wait a minute, I have the perfect answer, but I don't have it on Orchard Avenue.
Can I add crisis access, or should I just say crisis stabilization, crisis residential?
If we had an attorney here that could answer the question, I'd be happy.
Crisis access is not mentioned in the Camper report that I know, so I think we should remove that.
Okay, let's read the crisis stabilization, crisis residential.
So, can you reread it? Is it going to be similar to what's on the agenda?
Yes, it's going to be similar. You know, I'm leaving out psychiatric health facility because that's a separate issue. But it's saying, but what you're saying is, and it depends on how you read this item, that we're considering all three of these things. So I would like to separate out two of them and take a vote on those.
Okay, so there's a motion on the table. Anybody would like to second it?
Sorry, I'm so bad, but I need to know the new motion, please.
Okay. So there is a motion to recommend to the Board of Supervisors by Member Barish to recommend the release of an RFP for a CRT and CSU for design and cost to construct.
All right, so we have a motion. Is there anybody who would like to second that motion?
I'll second it.
Okay, so is there any discussion? Jan?
So it's not clear here if we're talking just about construction or if we're talking about construction and purchase of land and running it. And I think that it would be difficult for people to answer an RFP without those details.
Well, it would be my understanding that it wouldn't be us for the specificity of the details as much so as the Board of Supervisors and the contract or the RFP organizers, but
That's your admin staff.
Sorry.
Okay.
I would just say that as the contracting and purchasing agent for this county, I'm not certain how we would release an RFP just with that information. So I don't know.
So, Carmel, what would you suggest to next step to get this up?
Well, I would think if we were going to make a recommendation to release an RFP, that it would be on separate facilities, separate services. So are you thinking separate RFPs, request for proposal? Or are you thinking one for all the services? That's one question that I have. And I think there was also a comment, Sheriff, earlier, and I'm not sure where this went, about RFP versus sole source, and I think this came from the staff. And I'm not clear on, I appreciate Tammy's comments. I guess I would still need clarification really on what the county's commitment was and what the county's commitment is in reference to this action item. I mean, this is so huge. This is really huge what we're trying to vote on here. So I guess I would need more clarification. Could I ask Tammy to just clarify yet one more time what the county's action?
Okay, you're not the maker of the motion, but I guess if she wants to answer your hypothetical and then let it go to the maker of the motion, then he couldn't hear the answer.
I'm certainly not discussion. Go ahead.
And Tammy Moss-Chandler, Director of Health and Human Services. So the county has a current contract. I do not have it with me, but I can go get it. That contract is in partnership for the grant money of $500,000. And it is for the start of purchase of land and any money that could be used for the start of a construction of a crisis residential treatment center. That is all we have is that contract and a mental health service plan that says it's the goal of the county to find other money to continue to try to build and support that. And that contract is in place right now, active contract.
Request for change order?
If I could ask one more question, I should clarify, I hope. So at this point in time, we could do a request for proposal for either crisis residential treatment or crisis stabilization because we do not have a binding contract that binds us to one location, one contractor. We don't have that.
We have a contract right now that actually gave the funding to RCS. Yeah, Dan? Is it to purchase land at Orchard Street? That's why people call it Orchard Street, and it identified that location, and the initial funding was used to purchase land. So certainly there are other options we can look at, but that was what was done so far with some of that $500,000. It did purchase land. That's why I said we could work with county council on either what to do to undo that purchase or to continue with that.
Could I just clarify one other thing? It has been.
Wait, just a minute, please. Just 1 second, please, Camille. Go ahead. Anything?
No, I think just working with county council on the details of that, and certainly with the current grant funding that's come to RCS.
Camille, if you'd like to come forward.
I just wanted to clarify, the project has been, actually it's under the authority of Cal Mesa, and we, with the county, went and got that approved, which is how we were allowed to buy the Orchard property, and that's what engages us. So if we do undo it, we will need to go back to Cal Mesa and do it's Chaffey. Chaffey is who has it. That's all. The only comment is it's county, RCS, and
state
approval. So we need to undo all that, but just for clarification.
Sheriff, my final comment on this is that if there is a motion that goes to the board to recommend that we put out an RFP for these facilities, it will, I believe that it will take some time to clarify exactly what we need to do, what the county has done so far, and how we would move forward. So I just want to put that out there so there's no thought on this committee that we vote this, we take it to the board, they vote yes, and we move forward. I can't imagine it happening like that.
I've been involved in RFPs for this county that have taken 3 months to prepare the RFP for a computer program. No joke. So I would caution this committee to think that an RFP, just assuming that we just hand the ball off to the county, is going to be carried quickly and efficiently because of so many legalities that are required for this. However, we have to start somewhere, and if this is a start of it, then and it passes, so be it. My concern is why there's no PHF involved in the RFP, because when Measure B was passed, the psychiatric health facility was one of the main parts of the voter interest, and I speak with the authority of knowing that.
That might be the simplest recommendation.
But, I don't disagree with you, but I don't see, first of all, why they have to be mutually exclusive, because I don't think one needs to delay the other. I think that just by the nature of it, one is going to be delayed no matter what we do. And so, I don't think that doing one as opposed to the other has to be mutually exclusive. I think we can do both. And I think we're charged to do both in a certain sense, as far as Lee Kemper saying that these are our priorities. So I don't see that we're denying the voters what they want by going forward with this.
So on action item D as in David, which is the next on the agenda, this conversation can come up because that would certainly allow us to get a whole package of RFPs, at least to the level of the Board of Supervisors, so they can direct council and other contract providers or contract writers to work on RFP.
And furthermore, I'm horrified at the idea of sitting in your seat.
I'm looking forward to it.
Yes, and I freely admit being inexpert at putting together motions to this in this magnitude. So any recommendations or advice I can get, I will be most grateful.
Thank you very much. But you are very good at being a doctor, I want you to know that. Personal experience. Ross.
So I just reading through this and understanding the restrictions that the agenda item kind of places on what Dr. Barish is trying to accomplish here. It seems you got to do probably a little more heavy lifting up front. I've been involved with a RFP with the county, and I've spent probably, we sent the RFP out, and I'm well over $150,000 into creating enough documentation to put out a good RFP. And I just think this needs a little more heavy lifting before you do that, because I don't think it's really tight enough in your head at this point, sorry. And be specific about, in our case, it was just an RFP to do the design of a road. And just an RFP just to get everything close enough, it's, $150,000 to get everything together close enough to do an RFP to build the road. And this is just an RFP to do the design to build the road.
But the good news is, we as a Measure B committee do not have to do that heavy lifting.
True, but I think it has to be done if we're going to make a recommendation. That's not my decision, that's his decision.
Okay, Dr. Berry.
So, an alternative, recognizing, I think if I were RCS, I'd be loath to continue spending money on this if there wasn't some commitment from the committee in one way or another. So an alternative that might satisfy also the financial interests involved is to suggest that we give the money to RCS for the plan so that we can determine how much this is going to cost, because, and then we'd have more information to go on to move forward with the construction project. But and again, I'm very inexpert at this, so I don't know. I can't mention crisis access, even though that's in the plan for the Orchard Street, and I can't mention Orchard Street, as part of the motion because of the Brown Act, which I don't understand. Right. So, you understand my intent. Maybe you can help me with what we can do.
Okay. Russ.
Well, you're talking, and I appreciate what you're trying to do. He's trying to get, commit to giving the money to do the design. But the design, the work to do the design is probably going to be over $500,000. You know more about this than I would. The design's going to be that. It's expensive. It's really expensive. So when you're going to commit that kind of money, that's a big deal. $1 million here, $1 million there, adds up to real money.
So, Doctor, it's my understanding that RCS has gone, and with HHSA, has gone through this 3 years ago with the Board of Supervisors.
Yes.
And maybe a simple vote to support what the Board of Supervisors have done with RCS and work towards accomplishing that task would be all the Board of Supervisors would need from this committee to know that we support the progress on this, and then they can go forward with the plans that were developed before this Measure B commission was even conceived.
So what would such a motion sound like?
We have a motion and a second on the table.
Yeah, you have to vote on
we have to either pass that motion or let it die from being defeated.
But in your opinion, that's too broad to really be useful.
I think that if you ask the Board of Supervisors or tell the Board of Supervisors that this committee supports the action they've done in the past in their cooperation with RCS, that might give the Board of Supervisors enough direction.
I would prefer to withdraw the initial motion and go the other direction.
Okay, and the second, the motion says
He has to withdraw his.
Okay.
Second.
Yeah.
Whoever seconded it.
Yeah, I did, and I agree, I'll withdraw my second.
Okay, all right.
He's withdrawing his.
So we have a clean slate right now.
Yeah. So I would like to propose that, say this again.
No, it's your motion on mine.
That we encourage the Board of Supervisors to move forward with the plan that they already formulated with RCS.
Sounds like a great motion.
Okay. For crisis residential treatment, crisis stabilization, and crisis access. But I can leave out the access if you. But that's the plan.
Okay, so there's a motion from Dr. Barish regarding the Orchard Street property, very specific, that the Board of Supervisors and RCS and HHSA has already worked with the state on. Well, it almost is. You don't think C covers that?
Not in my mind, but I'm not a Brown Act expert. necessarily.
Sheriff, I do think there's some question as to, well, you know, honestly, the whole meeting, whether we're running it compliant, but I think with that particular motion, I'm not certain that is run and compliant, which, you know, hopefully by the next meeting, we will have a Measure B attorney with us.
And just so I
Before the next
understand,
meeting, so we can have it on the agenda correctly.
yeah,
We could bring an item forward for this, the first meeting in January, our chief counsel bring it forward.
I'm sorry, couldn't the board just could do that on their own, right?
They don't need our recommendation for that, but you can recommend that when you give a report out in January that the committee did have, which is true, very lengthy discussion about this, and recognizes the work that has been done by RCS and by Health and Human Services and supports that work. And also recognizes the importance of a crisis stabilization unit and a crisis residential treatment facility.
And Carmel's right, the board doesn't need our vote one way or the other to do it. It's just the vote to pass initiative states that we will make recommendations, but they don't, yes, Doctor.
But on the other hand, we're talking about recommending to put forth the money to do it. Which,
yes.
And that's, I think we have to do that, right? I mean.
Yeah, I mean, that's the appropriate thing to do.
Right.
I don't know about the legal thing.
Right.
Those two things don't always go together.
So my understanding is that the consensus is we should wait till the next meeting to have a proper motion that's been approved by legal counsel. And then I hope legal counsel helps to state the motion.
However, at the first Board of Supervisors meeting in January, I can pass on the feeling of this conversation. So to the other committee members, if you have something contrary to what has been discussed, please weigh in now so I can pass your words on. Or if you could join us at the Board of Supervisors meeting so you could present it yourself. Shannon.
I do have concerns about sole sourcing the operations of the facility. So to the extent that it was recommended in the Kemper report, I agree with the need for the facility, but I would like to see an open process for the operation of it.
Agreed.
I just want to make sure we're clear that that what HHSA and Behavioral Health has contracted with and our agreement with the state is solely for a crisis residential treatment. We don't, not crisis stabilization unit. So I want to make sure we're clear on that the CRT is the only part of the grant dollars in what we contracted with the state for.
And so would the state be prohibitive of the other things in the building?
No, I don't think the state would be prohibitive of other things in the building. No, that would be fine. I just want to make sure you're clear on what we have a contract for with the grant funds. It's only for crisis residential. I just want to clarify what the grant funds are for.
That was news to me. Thank you. Any other committee members? Mark?
We could push this request for proposal if we included a psychiatric health facility in the second phase, correct? Because I think we're all in agreement that we would like to have a psychiatric health facility. It's tiny.
Well, the next agenda item, D as in David, is going to cover that, I think.
Well, that covered A.
Right.
A facility, maybe not the facility.
Okay. Okay, so we do not have a motion on the table. We certainly don't have a second.
Withdrawing it.
Yeah, okay. Any more discussion on this? Okay, any public comment on item C as in Charlie? Seeing none, moving on to 5D as in David, recommend to the Board of Supervisors to explore the use of Measure B funds for remodeling Ukiah Adventist Hospital vacant ER ICU for a psychiatric facility. Is anybody from Adventist Systems here? We had a presentation last month, and I believe between last month and this month, if you're not aware, Jason Morris, who's the president, Jason Wells, I'm sorry, the president of Willits is now the president of both Willits and Ukiah with Gwen Matthews' retirement. and he was the one who did the presentation last month regarding the 6-bed ICU facility.
Tom, just briefly on that, that was another one where we asked for an opinion from county council if the Measure B funds could be used to do improvements to private property.
Right.
So, and we don't have that answer, and that was an important data point on whether or not to support that.
Yeah, so
this is academic. I mean, to me,
it is an academic, and so Carmel has said hopefully in the first meeting in January we'll have that question taken care of. And I think it is to be quite honest, formality with the Board of Supervisors, because they don't want us to take any missteps either. So I rarely get the chance to give the Board of Supervisors advice, but my advice is going to be to give us legal opinions so we don't waste our time.
Yeah. It's a question presumably they're going to be asking themselves anyway, so
exactly
asked and answered.
And Sheriff, I would just suggest that we continue item D until the next, we can continue.
I think it's the right way to go.
January meeting, because we really can't make a decision, but it looks like we might be able to do B.
Any public comment on item?
We're good.
On B that we're going to recommend to continue on until January. No public comment. All right, E as in Edward, received data on current mobile outreach program services, MOPS. So let me tell you, we talked last month about MOPS, about the validity of MOPS and the effectiveness of MOPS. And I want to give you 3 years of law enforcement, and this does not include the 3 police departments, but it includes Sheriff's Office 5150. So emergency response to someone who has been deemed unable to care for their own safety, themselves, or endangered others. So we started with the 1 year of before MOPS was even in development. And so I'm going back to 2014. And so from December 2013 through November 2014, law enforcement countywide responded to 296 people. I'm sorry, we do not have it broken down into how many of them were duplicates, you know, of someone who may have, it happened 3 or 4 times in that year, but 296. So 3 years ago, the MOPS unit went into action. So from December 2016 through November 2017, that number went down to 277. And we have not had the ability, and I'll explain why in just a minute, of looking to see if these numbers were the same numbers that the MOPS teams were dealing with because of the confidentiality of some of the other numbers that mental health may have that law enforcement doesn't have. So it's like a one-way door of information unless it's an emergency. And then for the last 12 months, so from December 2017 through the end of November of this year, 270. So once again, those 3 numbers, 296, down to 275, down to 270. I'm certainly confident in being able to say that some of this is due to MOPS, especially since the fact that other counties are seeing an escalation of 5150 calls to law enforcement. And we're seeing not a drastic decrease, but we're certainly seeing a decrease at a reduced cost to the taxpayers. However, I'm not saying this in the fact, because I don't know the answer, that this is a cost saving to the public, because it's fair to say that the 30-some people who we didn't respond to, if you look at the 30% or 30-person number going down, they very possibly could still be involved in the mental health system, except they're not entering the mental health system through the form of law enforcement, putting them in the back seat of the car and taking them to the hospital, and hence the change. And so the MOPS team has reduced, I will say, with good reason to believe, the number of emergency 5150 calls that law enforcement responds to. And I think that's the question you asked me last month. Any questions on that? Any public comment on item E as in Edward? Yes, sir. Please take the podium and state your name. Thank you.
Very simply, I'm Bill Keller, and I'm with Porter with the ICO. I just want to know if that data is available publicly. If I can get a
We have
copy.
one copy, but I will give it to you.
All right.
At the end of this meeting.
At the end of the meeting.
Yes.
All right, thank you.
All right. Item number F is in frank discussion and direction regarding the procurement of a dedicated staff person for Measure B commitment with discussion and possible action. And just to remind you, the preparation for these meetings is important, whether it's a preparation of the agenda, whether it's the time-consuming minutes, and we are going to get into H to talk about action-only minutes instead of specific minutes. But what Dora Briley was doing before the formation of Measure B, she was very busy. I mean, it's fair to say that her work product was required more than 40 hours a week. And now with the Measure B influx of workload, she's certainly doing more than her fair share of work. And I'm not sure of the answer to this. It doesn't require a full-time person, but it certainly requires someone to prepare for the meetings, be at the meetings, and take care of the minutes afterwards. Anybody want to make a suggestion? Jan, yes.
Well, the Behavioral Health and Recovery Service Department attends to our meetings and creates minutes, and I kind of assumed that they would do that for Measure B also. So, and there's no cost to our committee that I know of, so I'm not quite sure why we need to add a cost and take it, impose upon your department.
It's the cost is not the aspect as much as the time that's involved for Dora. I mean, she's our grant person, and she works in the financial. And so now if we pass H and reduce it to action only, I think that her work requirement, and she can correct me if I'm wrong, will go from 12 hours probably a month to 4 hours. But Dora, do you want to weigh in on this?
Well, I just wanted to say, I think this is talking about the dedicated staff person that Lloyd had brought up in his report last month that I was asked to put on the agenda this time.
Oh, okay.
Wasn't necessarily about me.
Okay, so we have 2 dedicated staff people.
Yeah, I asked for that.
Okay. Okay, so let's talk about 2 dedicated. So Lloyd.
This was your item?
I asked for it to be placed on the agenda because it came up in the context of the draft budget that you presented at the last meeting. And that was the first mention I had seen of any dedicated staff, and I thought it warranted some conversation by the committee, because I think we are generating a significant amount of work, not just for Dora, but when we start to talk about project management and the research and analysis of some of the work that this committee will be doing, I think there will be some dedicated work. And I don't know what that looks like. I don't know how many hours a week it is. It might be a part-time contractor or something, but I wanted the committee to have an opportunity to talk about the amount of work that they see and what that might look like. Because later on the agenda is the budget.
Right.
So if we're going to adopt the budget, we should know what we're thinking of in terms of staffing needs and costs.
Carmel.
So I think that, having Dora do it, you've been very generous actually with her time, and Dora, thank you for all the work you've done. When I look at this, I'm not certain really in the long run what type of classification of staff person we would need. Whether it would be someone who is just going to manage the committee, and I'm not quite certain that Measure B allows us to hire someone just to manage the committee. So I don't know about that, but what I would suggest as an interim step until we can get a better picture legally of what Measure B will pay for, what we can do, and also what we actually need on this committee, is that county staff, and it could be someone from Health and Human Services, and I think Tammy walked out. Oh, there's Tammy. Yeah. So what we can do, Sheriff, is we can look at either Health and Human Services staff. I really think, and I don't want to say this without knowing the staffing pattern right now, but possibly one of the clerks from the COB, from the clerk of the board. I think that there are so many questions that come up around Brown Act, and whether we have an attorney sitting here or not, the clerks are really good with Brown Act and they keep us very much focused. And so I would say at this point to defer hiring someone right now until we know. It may be that this committee, and if we can utilize the funds, that we need a project manager, director of some sort. If we're actually going to build buildings, those buildings will be project managed, right, by construction managers, but we would still need somebody to manage everything else. So if we could utilize county staff, whether it's clerk staff or health and human services staff right now, to get us through the next couple months until we determine what we need, that would be my alternate recommendation to this.
I do believe the ordinance states that the sheriff's office would supply someone to actually clerk the meeting, so just to put that out there.
The ordinance does?
Yeah, I have not seen that. Kids here.
Okay, we're looking at it. Okay. Okay. So if we get to that point, I mean, if somebody finds out, interrupt me and we'll go back to it. Is there any public comment on?
Yeah.
Oh, I'm sorry.
So I'm actually I just wanted to express I'm supportive of that notion, and I think we do need a little more horsepower than just, I don't want to say just a quick but, sort of an analyst kind of person that can help, just sort of as Carmel laid out, there's going to be construction projects. Granted, they're going to have construction management, but having a little bit of oversight on that sort of thing would be valuable to our mission. I think a lot of stuff comes up that we would like to really understand better, and we're all unpaid volunteers here and worth every penny of it. But we we don't have time as individuals to go research this stuff and understand it better, and an analyst would. I think that kind of horsepower would be really valuable and would really help us accomplish our mission.
I know the county offered personal service contracts for people who are very specific towards a solution to a question we have. And that could be where we need to go if we can find the right person. If we put out an RFP for a personal service contract, and we'd say these are the job duties, and if you would like to have this personal service contract, respond to RFP.
I wrestle with Carmel about which one of our staff people we can steal away for a few hours a week. I could take it. I knew I could.
Okay, so discussion and direction regarding this. Is there any direction from this committee? The table's full. We table it.
Well, I don't see where we can make a decision personally. That's my personal opinion.
I didn't hear it. Say again.
She doesn't think we can make a decision legally.
Sheriff, I think that this motion, a couple things. The motion could either die, or it could be continued as everything else. I don't think that the Measure B committee would need to weigh in and make a decision on spending Measure B money to hire somebody. But the very fact of whether, Sheriff, it's your staff person or HHSA staff person or one of the clerks to manage this meeting at this point in time, the Measure B committee really doesn't have to vote on that. You just have to make sure that we've got somebody that can do the job, which you would know in January.
So Carmel, what if we had a very small ad hoc that put together the responsibilities for this person to say these are the duties which this person would be required to do?
That would be fine. I guess what I'm thinking right now is that one of the reasons this came up is because of Dora's workload and that she's inundated. So what, not to be so black and white, but I think what we need right now is someone to do exactly what Dora's doing. And then, the ad hoc would be to really look at a person more long-term and I'm not certain that we have, since we don't know what we're going to build, we don't know what we're going to spend this money on or what we're going to do, I find it difficult to decide what skill set I would want sitting here to help us do what we don't know we're going to do. So in that regard,
other than a paid manager to say, this is what other cities have or counties have, and this is the direction. Because unfortunately, we all have busy lives, and none of us have the ability to just focus 100% on the questions that you're bringing up.
So if we could do two things. One, it would be up to the county, whether it's you, Sheriff, Tammy Moss-Chandler, myself, Janine, to decide who's going to sit in Dora's chair next month. Forming an ad hoc to develop a job description or classification, task list, whatever, for the type of person we want to support this committee, that absolutely could happen, and we should put it on the agenda for next month.
Okay.
It is not agendized.
We will put on the agenda for January.
Thank you.
Okay. Any discussion on this?
We have to vote on the budget too. I think that's the next. Right, we gotta vote on the budget money for this, these services.
It doesn't cost money to budget.
Right, doesn't cost money to budget.
But arriving at that budget is gonna say a lot about what we expect that person to do.
Yeah, but as of now, it's doing the minutes. Right?
Yeah.
As of right now, it's doing the minutes because we have nothing else to say. And as of the last year, that's what we've done. And plus, see, Janet, don't get me wrong. I'm not saying that that's the light job because it's not. Dora.
I know how much time and energy and thought she puts into it.
And removing Dora from that seat isn't really high on my list because I think she's done a great job and she should stay there. It's just budget money to fund it.
And I appreciate that, and maybe it's something Dora and I can talk about.
Yeah.
I don't want to ask her.
If she wants to leave.
I'll ask. She said she does. All right, is there any public members who would like to weigh in on this? Public comment? Hearing none, we're going to move on to the G as in George, recommend Measure B budget summary to be presented to the Board of Supervisors with discussion and possible action. Lloyd Weir.
So, again, I'm not asking the committee to make a decision on what we're going to spend the Measure B money on in specific detail. However, we do have some bills coming in that need to be addressed. Staff time right now, and I believe one of the Kemper bills is still needs to be reimbursed. So we can't do that until we have a budget. I was trying to vision something between now and June 30th to present to the board to kind of give us some appropriations so that as we vote and recommend to pay bills, we have appropriations to pay them with. It's not intended to drive decision-making. I did include some things in here that were in the measure so that in case we want to go down a certain road, there's an appropriation to get us started, but by all means, it can be changed, it can be increased, decreased. This just gives us a starting point of what may come up between now and June 30th and something to bring forward as a recommendation to the board. So it's similar to what I passed out last meeting. The $50,000 for professional services is for the Kemper or other consultant or contractor need. This would have to be approved by the board. It's not committing us to anything, but it's there in case we have an expenditure to occur and we have the appropriations to do it. The $20,000 for sheriff and other staff, this again is any work that needs to be done on behalf of the committee that would have to be reimbursed to one of our county departments. I have now put in an item for the MOPS team, since that was a recommendation and may be approved by the board. It has not yet, but here's a starting point where we, if we do get positions approved in departments that will work on MOPS teams, we could have the appropriation available to start reimbursing those. Again, it's only from February to June because that's my understanding about when these may get organized. So, and then the big item, the $1 million, is just in case we make any decisions about a facility or services that needs to be performed, and we have the ability to start. So again, nothing in stone. This is just a recommend. My guess at a proper amount to put in to begin to start with, and we can of course change any of these or just send it forward and see what the board wants to do.
Okay.
Excuse me, I have to leave.
Is there any committee members on this that have comments? Any public comment on the budget? If you've not seen a copy, we'd gladly give you time to look at a copy. Anybody who would like to make a motion? Dan?
I move that we accept this budget for to be recommended to the Board of Supervisors as a tentative cost.
Okay. There's a motion. Is there a second?
A second.
Any discussion?
Mark wanted
No,
to
that's all right. Wait, Mark. Any discussion? Seeing none, all in favor, say aye.
Aye.
Any opposed? Hearing none, so carried unanimously. Thank you very much. Is that all?
We did something.
Yeah, we approved our budget.
Yeah, that was
Grab money.
My hand's up already for the next time.
Okay, we're running a little late, but this is a very important topic. H, changing Measure B minutes to action-only minutes with discussion and possible action. Anybody who would like to talk about this?
You already know. So I detest action minutes. They don't tell you anything except what happened. They don't tell you how it came about, etc. I talked to Dora, so I've done my due diligence since I'm the fly in the ointment all the time about minutes. I really am. So I did my due diligence. I talked to Dora, and I think I have it figured out so that it will cut her time dramatically. We can still have summarized minutes, which the public is entitled to, in my opinion. I'm not going to spend 2 hours looking through a video to find one piece that I wanted to find when I can take 10 minutes and read very good summarized minutes. So I think I have it figured out to save total time, total effort, make it easy on her, make it easy on everybody else, and cut you down to what, about 30 minutes, right?
According to what you said.
Yep.
To do what?
To put the minutes from the tape recorder to her deal and proof it.
Okay. So there's software, Dragonware, I believe it's called, something that turns our voice into text message or into type. The problem with that is we don't all have microphones in front of us, and I'm involved in a sheriff committee that if you don't do this, it often changes a word. And words are very, very important historically to go back and look and see. Yes, Donna, do you have anything else?
Yes, I researched all this.
Okay.
And it's one that takes care of the whole room, automatically adjusts itself, etc. So you will get everything.
Okay. We do have a discussion possible action. Is there a cost involved with this?
Maybe, maybe not. There'll be cost saving. I have to actually, to be honest, I have to call the company.
Okay.
And find out all the particulars.
Okay.
But I'm willing to do the legwork.
Okay. So it'll be on next month's agenda with the cost and everything else.
Cost and everything.
Yeah.
And a cost savings, if there is one, which there will be on Dora.
So that would still be transcribing what's said, which I don't consider minutes. I mean, I can understand where just action minutes would have what was moved and passed. But I mean, when I take minutes, I put in the discussion that happened so you know the gist of the conversation. But not transcribing the whole thing.
Right. When she proofs them, which will be her only job, she will take out the stuff that doesn't need to be there.
And put a title when the conversation topic changes.
So what would be the percentage of reduction in pages?
Probably none.
Well, that's my point. That would still
Because
be
I personally, I love these minutes. I absolutely love them.
Maybe you could just do that for now.
Yeah. No, and I'm willing to take over the groundwork also. I've already commented on that because I'm the fly in the ointment, and when you're the fly in the ointment, you have to take over the responsibility, so.
Okay. Yes.
She should be vice chair.
I'm getting real close to it, I'll tell you that right now.
Come with your signs.
Okay, we don't even have to vote on it, it'll be on the agenda next month, all right? Any discussion on, any public comment on this? Okay, hearing none. You have any committee member report out? Janine? Jan?
I went to the UP Trails opening of the Center of Healing Arts, which was wonderful. And at my board meeting, I gave gifts to my board members, which I would be glad to share with you. It's a moon chart. In schools, we call them behavior indicators, and people in emergency services often appreciate it.
Okay, thank you. Carmel?
No, I just really appreciate the discussion we had and these items that continue to come up, but you can see, you know, the interest and the passion in the room, and so thank you for that.
Doctor? Doctor?
Oh, nothing to report.
Ross? Good. Hope you get better soon. Lloyd? Me too. Mark?
Met with Fort Bragg Coast stakeholders that included Mendocino Coast District Hospital, Mendocino Coast Clinics, city manager of Fort Bragg, city council person, and RCMC, RCS. Topics, there's a lack of mobility within the city limits of Fort Bragg, so if there's a crisis situation, you have two options. If a person walks into your doctor's office, which Mendocino Coast Clinics has, their only option is to call the local police department, who gets very upset because they're not a taxi service, or they leave their position and walk to the emergency room. So we met with our QMC to discuss the options of adding mobility within the city limits to strategic locations such as the school, the hospital, which they already go, Mendocino Coast Clinics, maybe a couple other spots like the Hospitality House, maybe one other. So that was communicated. They're going to go do some research and see what they need to do that. Also talking about the lack of services in crisis for mental health patients, which we're all here talking about. And really what Dr. Barish is trying to say, everyone is really saying outside, is that we need a CRT and we need a CSU. That's what they feel need, because that's the interim. Because if there's a 5150 that's a danger to themselves, they got to go to a psych hospital, so they need to go to the emergency room anyway. But what we don't have is another option to that. So what's pretty clear is that we need a CRT CSU right away. So that was what they said. So that's basically it.
Ken? I had an opportunity to meet with the Fort Bragg City Manager also, and I'm encouraging people in Fort Bragg to look at the county website at the end of January for the MOPS Sheriff's Office employee as well as mental health. I'm sure they'll be looking at something, because our county Department of Personnel is creating hopefully a very specific job description for the MOPS team. So we can look at what qualifications are out there and getting the right people. The state sheriffs met last week in Napa. I was there, and we had an opportunity to speak to Governor Brown, and Governor Brown assured us that Governor-elect Newsom is understanding the need for county to have resources to improve mental health services. So we hopefully will be able to parlay some of our Measure B money, as in money necessary for a county match, for ideas that the state and the new governor are hopefully going to be putting on the table very, very soon. So it would be a great parlay to be able to immediately say we have the 25% match or whatever it's going to be for some new facility. Because remember, we're the only county in the state that has taxing that's going to improve mental health. We should all be very proud of that. Other than that, I wish everyone a happy holiday. Thank you.
None.
So are we adjourning?
And the meeting is adjourned. Thank you.